Tip number 3, know your skills gap. So there's a very big difference between the skills that you learned in nursing school and got to practice on patients in a clinical setting and the skills that you need to know to do the job that you just got hired to do. So I got the absolute pleasure of having incredible mentors in the real world when it came to learning how to start IVs. I learned some incredible tips and tricks on patients who were difficult starts. And I was able to grow an incredible skill set on starting IVs on adults who are difficult sticks. Now, I decided to shift into pediatrics. Now, I told you I've been a nurse for almost 20 years, and I shifted into pediatrics about a year ago. And all of those incredible skills that I had were a foundation, but they did not all translate into the skills that I needed to start an IV on a 1 day old baby. There was equipment out there that I didn't even know existed. I had no idea a 26 gauge IV existed until I saw a NICU nurse bring one down because I needed help starting an IV on a 1 day old baby. Right. So I recognized right away that I had a skills gap. What I knew did not translate to what I needed to know in order to do the job and function in the role that I was currently functioning in. And this is another area where you might be tempted to say, I suck and I'm failing. Because guess what? There was a good, like, probably 4 weeks where I had to call somebody else in the department. I had to call the PICU. I had to call the NICU. I had to call the PEDS floor. I had to call in backup to support me in starting IVs and drawing blood on my teeny tiny babies, on my rowdy toddlers, because there were tips and tricks and skills and nuances that I didn't learn. Or if I did learn them 20 years ago in nursing school, they were long gone. And I needed to know my skills gap. And I needed to be willing to ask for help to learn those new nuances in skills.